Okay, we'll move right into the study session. The first is Fire Department, call on Chief Weisman.
Yeah, a few items for you this morning. The first one is we had an open lieutenant position. 5 members were tested, successfully passed the written exam. All 5 candidates moved on to face the panel. They were evaluated on their skill areas in fire suppression, hazmat, personnel matters, and then instruction or teaching. All candidates scored really well, so we're really proud of them. Ryan Zerbick scored the highest out of all candidates, and firefighter Zerbick has a proven work history. So he excelled during his career with McPherson Fire, so we're requesting to promote him as lieutenant for our vacant lieutenant position, effective May 4th.
Okay, I'd like to say that this is a good thing. It's a change, and appreciate the efforts of all of the firefighters that put in for this. In past times, we have not got as good a response of everybody working and passing the test with excellent scores. So congratulations to everyone there. Congratulations to Ryan, and we'll have our usual promotion pending when times permit.
Thank you. The next.
Did you guys take action?
This is a study session.
Study
Oh,
session.
I'm sorry.
You've
I
got-
pulled
You've got
this-
miritis.
I do. Sorry about that.
I was going to say that.
Yeah,
but,
so you click up on Jeff Houston, he's probably throwing his hands in his air on his video. Okay, here we go.
They did unmute.
What would you like to talk about?
Not really anything, but I'm glad to see you're awake. We miss your face.
You would be the only one who's never said that.
Well, that makes me unique. Okay, continue, please.
So the next item we have a little show and tell for you this morning. We have been utilizing a lot of these filters, the P100 filters, for the COVID response. Unfortunately, the filters that we had several pairs that were given to us through grants after 9/11, and those you can imagine how old those are then. This is what they moved to. There's a problem with getting this. This fits on our current SCBA mask, which we're running low on these, and we can't get these filters anymore. So being able to get the new adapters for these is what we're talking about next with the PAPRs, and being able to use the new filters for our CBRM, which is chemical biological response. So the PAPRs that we are looking for and the P100 filters come to $2,385.50. We'll have to absorb that in our budget this year, so it wasn't something we were anticipating, but
so how many will that buy? What's the?
so that gives us 2 PAPRs, and then we'll have 80 pairs of filters.
Okay.
So which is putting us back to where our stock pretty
Good.
much was.
Was there any chance of getting any FEMA reimbursement from that?
There is. We just got to document it, and it's going to be reimbursed at 75%. So
75?
Yeah,
Good. Okay.
okay. So you bring it next week?
The next item is the fire department utilized the park department trailer for emergency response, the UTV, and we appreciate that. But on that call, the trailer was very inadequate for the weight of that UTV, and we had a lot of fishtailing going on when we were on our way over to a call for service near Canton, and it caused them to have to really slow down and degrade the response from going. I think they had to travel at like 35 miles an hour on 56 highway because the trailer was all over the road. So looking at that, and we also have several props that we take around to the schools for fire prevention, and we have to usually borrow a trailer for that. What we were doing was picking up like the bounce house and sticking it in the back of the squad, which is really hard on our people to have to pick up that much weight 3 or 4 times a day. And then when they push it out of the back of the pickup, it lands and hits the ground, and it's really hard on the bounce house and the other equipment too. So utilizing a trailer is what we really need to do for that equipment. With that being said, so we went looking for a trailer that would be suitable for this and split the cost between the city and the fire prevention fund. And we got quotes from several places, and Mack Trailer came in at the lowest with $3,400 for an 18-foot trailer. So we are asking that we split the cost, $1,700 from the fire department and $1,700 from the fire prevention fund to purchase a trailer.
Okay, I think it's a good move that has to be done, and that you could bring this next week. And because of the ownership of Mack Trailer, there'll only be 2 commissioners that will make the decision next week,
I might just add that I am not the owner of Mack Trailer Sales,
but you're involved.
but I'm involved in Mack
Yeah.
Trailer Sales as a sales manager. That's
Yeah.
correct. And
Right.
I'd also like to say that Mack Trailer Sales is not open due to the COVID-19. So if approved next week, depending on what the governor's response is, all the paperwork and so on will be postponed till then. And but the trailer will be put on hold for the remainder of that time.
Chief, I wanted to ask you, is anybody addressing that issue with that trailer from the park department? Was that the one they used to haul the mowers on?
No, that's the old green camouflage one.
That's what you were using?
That was what we were using.
I understand.
Okay, so just bring it next week, and we've announced that there will be, but the bid is a more than competitive bid.
The next item, we had a recent fundraiser with Midway Motors that brought the restoration account for the 1928 American La France restoration to $23,000, 532.14 cents. We've taken the truck out to Tim Unruh, which is out on 81 bypass, and they're going to start the process of disassembling it. Tim and Dalton Whitfield of Last Century, which is over in the 400 block of West Kansas, are going to start working on the apparatus to start in on the restoration project. And we would like to start off with giving each of those guys $2,000 to get going on those projects, get the motor running in conjunction with Mack College. They're going to rebuild some of the things like the alternator and the carburetors and get that motor back up and running again, as well as remove some of the body and get that down to Wichita so they can start in on the restoration project on the body. We do have a contract that I'm going to get over to the city attorney before next week, so you guys will see that with this next week with the contract. They asked us to carry insurance on it, which we obviously are already, and not hold them liable if there's a fire in the building or something of that nature. So we're working on that, and you guys will see that contract approved by the city attorney hopefully by next week.
So the funds you're gonna use to do that have all been donated?
That is correct. None of this is taxpayer. It's all donated funds. Judging by what we've heard, commitments, we're going to have a significant more amount of money coming in over the next year or so. So well, I think we're on the right track into getting it restored.
Good.
All right.
That's
Okay,
all I have.
Bring it next week.
okay.
Whoa.
That's what happens when you don't hold on to your air pack. Okay, I'd like to call on Ralph Wayne Burns. Here's Ralphie.
You were waiting on that one.
Yeah,
Golf course, their annual GHIN membership dues are due to Central Links Golf of Lenexa, Kansas. It used to be Central Links Golf of Kansas City. so they must have moved to Lenexa, but the amount is $1,364 for 61 golfers that are members at Turkey Creek Golf Course, and this is included in their membership fee also.
Okay.
So, bring it next week?
Yes.
Okay, thank you.
Good, thank you.
Public Works, Jeff Woodward.
We put together an estimate for all the pavement patching and curb and gutter replacement, also sidewalks and driveways that need to be completed prior to the 2020 mill and overlays. That cost estimate's $21,864.38 for materials only.
Okay.
Okay, you'll bring it next week?
The other thing is Larry asked me to bring it. I just got the information this morning, so it's not on the agenda. But our concrete truck, when running, it's trying to burn antifreeze, so the head gasket's going out of it. So we were holding off as we were asked to do, but I think we need to replace this truck before it happens. As it happens, Midway Motor or BPU traded into Midway Motors a 2009 Ford F450 with a crew cab. To get their new box on their new truck, it took like 11 months, so they continued to drive this truck, and the motor went out of it, so they put a brand new motor in it, and the new motor only has 3,000 miles on it. So it's available here for $19,199 plus an administrative fee of
$300,
$299.
$299.
And they're willing to give us $4,000 for our old concrete truck. So
We're talking about almost just under 18,000 net.
What year is this
Wait.
concrete truck, and
No.
how many miles does it have on it?
Yeah, it has 3,000 miles on the
New engine.
motor, and it's a 2009 on the chassis.
and it has 70. I think it's 79,000,
73.
73,000
Yeah.
miles.
Are they all Fords?
Mm-hmm.
On your current one?
Current one, what?
On your current concrete truck,
The miles on it? I don't know.
what year is it? You know that?
2002.
2002, okay.
So we're going up 7 years, basically for $20,000, and getting a truck that's got a brand new engine in it. If something happens to the truck that we currently drive, and we put a new engine in it, why, we're going to be down with the concrete truck and so on. This one is available to us at this time, and I know that we had said that we wanted to put buying equipment on hold, but when you get into a situation like this and we have that available, it would be my suggestion that we would proceed with that.
Was that a budgeted item?
It's we have $35,000 budgeted for trading that vehicle in this year, so we're going to be $15,000 under what the budget is,
Okay.
and hopefully have a new truck. And I went out and looked at it yesterday, and it's obviously looks don't tell you a lot, but it's not a beat up truck, and the concrete truck that we have now, they get a lot of abuse when they start moving equipment in and out of it, and it's got one of the utility beds on it, just like the one that we have now.
We did contact BPU, and they said it was in good shape.
Yeah.
That's how we found out about the new motor in it.
This is Donetta. Is this out of the equipment fund? Or
Yes.
what fund are we talking about?
Out of the
Equipment fund.
Yes, it comes out of the equipment fund. Janetta?
Any here?
Thank you.
All right,
Okay.
so bring it next week.
I'd say bring it Monday.
Okay. I'll go
Let's-
ahead and add this item onto the agenda for today, then,
Okay.
For today,
And
to the study session for today.
yeah.
make sure it's documented.
Yeah, okay, thank you. Okay, calling Nick Gregory for the COVID-19 EOC update.
Thank you, Mayor. I'm here to give the briefing for the operational period that went from April 7th to May 4th as it relates to the COVID-19. As you're aware, we meet on Tuesday, our EOC group meets on Tuesdays to discuss items. And what I bring to you today with this briefing is everything that's happened, including from that meeting on Tuesday and everything that's happened since then. I'm going to try to hit just the sections that have changed at this point. I will say that we're continuing to as of this at this point in time. Do want to give a report from what the latest we've heard from McPherson County Health Department's been. As of Friday, April 24th, there were 20 identified cases or recognized positive cases in McPherson County, and they reported that there were 13 confirmed recoveries, so there's 7 that are still sick with COVID-19, and that includes the individuals from the cluster outbreak. And then also last week, they did also indicate that there was a second employee at Dillon's Grocery that was infected with COVID-19, and since that time, they haven't listed, I think maybe they've listed one additional case since that second exposure, so I'm expecting to get an update probably later on today. I would also like to report that in our EOC group, we've added the emergency manager last week to that meeting, and we're going to be adding the health department director. We'll be attending EOC this week. So
Yeah. County Emergency Manager.
County emergency manager, yes, and county health department director, which is a pretty big deal. We're glad to have her aboard to kind of give us an update as well. There weren't any significant changes to any of the biological disinfectant response for city-owned public assets. We did, with the exception of Turkey Creek Golf Course, which last week we opened. We reopened to Touchless Golf. There hasn't really been any issues with the sanitation guidelines as set. We did talk to, I did get a report late last week, and they're having to make a few adjustments, but overall I think things have gone well. And actually we had several really, really good revenue days last week. I don't know where we're at this week, but I think people were ready to get back and playing golf, so it was a positive. And we'll continue to keep our look at disinfectant costs, PPE supplies, and the measures that we're doing. If we've got to adjust those to make sure we're providing the safest situation, we will continue to do that. We did get just a little bit of an update from Dillon's and Walmart, what they're out there doing. Obviously limiting the number of interactions between customers and employees. That's been implemented and fine-tuned. They have got limited service hours, which allows them time to dedicate to disinfection and also get groceries restocked without blocking a lot of the aisles. So they've obviously adjusted those times, and they'll continue to go down that route. Sanitizing carts is collected and regularly. They have a little different cycle, but that's one thing that they've tried to do is make sure we're getting all those carts sanitized after they're used to avoid any spread that might come from that. One-way entrances and exits at Walmart, that kind of was already implemented the week before, but they've kind of fine-tuned some of that. At Dillon's, they have 7 to 8 a.m. Monday through Thursday is limited for senior citizens, which is a good thing because those are most susceptible. They've tried to limit the amount that go there and who uses the grocery store. If they're disinfecting in the evenings, giving that advantage to senior citizens is a good thing in the mornings. They both have working with professional disinfection and regular and nightly disinfection, as I mentioned, and at this time at both stores, employees are required to wear face masks at all times. So if you go into Dillon's or Walmart, you'll see that as a regular thing. And if you notice, you'll see a lot more customers wearing them as well. So that's really just the only update we really have there. We are making several.
I'd just like to say one thing on this. Even though the store staff are wearing masks, you can be on the safe side. You can wear it while you're shopping, take it back off when you get in your vehicle. I think if we want to be our numbers as low as possible and keep them that way so we can get the town back in gear and other things open up. So the more we do that, the better off we are.
As far as continuity of city services, we continue to make small adjustments. I think we'll talk a little bit potentially about it at the EOC meeting this week, but as some of this stuff starts to wind down, how do we transition out of some of the plans that we're doing? We'll continue to discuss those, and we'll continue to make adjustments as we need to make sure we've got enough staff to keep the city running. I'm going to jump down. A lot of these are the same, haven't changed significantly, but going down to an update on ensuring all citizens are able to, in a safe manner, to secure all the resources needed to live from home for an extended period of time. We do have some updates there. CASA, A Voice for Children Incorporated, received 6 new cases. All services are being conducted virtually through CASA. Heart to Heart Advocacy Center, which is located here in this building, has had 5 new cases for April. They anticipated that referrals will increase due to current health crisis, and they've also applied for the Kansas Health Foundation grant. Heart to Heart has. Housing Coalition has 3 new families that have been served and provided housing and case management since April 1st. And the one thing that they've identified is food is the most significant need identified through the Housing Coalition. Cerebral Palsy Research Foundation providing emergency services currently, and they've increased their cleaning processes. STEP MC, which is used to be Steps to End Poverty of McPherson County. Food has been identified as the most significant need for them as well. As time goes on here, as the mayor mentioned, need for food and the availability of food is going to continue to become a bigger issue. Y-Kids, which is through the YMCA, has applied for Kansas Health Foundation for funding to offer exercise to elderly population through electronic devices and for sanitizing supplies as well. YMCA is closed through May 3rd. Y-Kids is operating, and there are still several openings, and they're providing really a needed daycare demand right now for us. And if there are still folks that need that, they do have that available. They do have several spots that are still open. Grace Med typically is the clinic that serves a number of underserved populations. Typically, the clinic has on average of 130 to 150 patients a week. However, due to the health crisis and restrictions placed on COVID-19, 20 patients are seen weekly on average right now. So obviously, it's like every other healthcare facility that's taken a little bit of a hit from all this. But they are still available, and I did hear, just happened to hear on the radio that I don't know if the one here, but some of the ones in Wichita are doing testing now. So yeah, I did hear that was something new that is coming. Child Care Aware of Kansas has 2 new grants that are now available for family child care and small daycare centers. Child Care Aware of Kansas and the Kansas Department of Children and Family Services have partnered to offer these grants. These grants are available from April 21st through August 2020. And so, if anybody's interested in that, I'd encourage you to go out there and apply for that grant as quick as you can, because I know a lot of the grants that are out there are being utilized and utilized as quick as they're being offered. So if anybody's interested in that child care grant, go out and, I'd encourage you to go out and apply. They still do not have survey results available from the McPherson Community Foundation. They've got 2 surveys that they're doing, and we've not yet heard back on those as it relates to that. Jumping down a couple items to the industry partners that are continuing to coordinate the with industry partners to ensure critical industry continuity and continuous communication and safety precautions to prevent the spread of COVID-19. And this is being done. In the last week, I can report that they've coordinated with industry decontamination contractors to provide additional decontamination to the outbreak cluster facility. I think that they've put a lot into making sure that the decontaminations happen there is to the best of their ability, and we really appreciate working with them. We've discussed business restarts. They've discussed doing a business restart survey. They discussed that this last week, and they're in the process of doing that. They're currently reviewing data from industry communications that were sent out last week, and hopefully be able to put some things together that explain some of the data that they've been able to receive. And I know they met with the Greater Wichita Partnership last week to discuss assistance from McPherson Industry and help with potentially fabricating COVID-19 test kits and swabs. I think ultimately they found somebody that had a connection to a supplier that could do it, but I think the Wichita Greater Area Partnership had already found somebody. So it was still a good conversation to have, and if we can work to be if we can work with our industries to be part of that, I think it's a huge deal. But we'll continue to see however we can help as we try to get through this entire thing. Nothing new with the food trucks. We're continuing to keep an eye on those, make sure that they're using safe practices. As far as public health messaging update, there are a number of things that were done by the PIO group. Thanks, Sydney, for leading that effort. There was a photo challenge that went out, and I think there was a different thing each day. I think that went over well. There were a lot of people that once we got over the glitch of people being able to post some pictures, we were able to do that, and I think people enjoyed that. We did do a new toilet talk video, as that continues to be a critical issue. If you notice, you go into the grocery store now, toilet paper is starting to get back to normal. But the video we put together was a really good video because it shows you that it actually, you put toilet paper, tissue paper, and paper towels in water, and you can see how much quicker the toilet paper dissolves. And so I think that's going to be something we'll continue to put throughout the year, regardless of whether we've got COVID-19. It's something that I think people can really see to kind of understand why we are telling people only put toilet paper down. But I think it went out. It was seen as another asset that's out there for getting the word out about that. We have had limited amount. It could have been much worse, but we need to encourage people to still make sure that they're just putting toilet paper down the drain. There was some information that was put out on how to work effectively at home. We're not sure if this was passed along, but KMU is hosting a webinar on how to work effectively at home, and that webinar is open to the public. There's a link. Did you put that out on our Facebook?
On Facebook, and then there's also a Facebook event out there. We'll share it again on our Facebook page so everyone has it.
Yeah, so if you go out on our Facebook page, you can kind of see that link there. Instagram best practices for state and local government. There's another resource that many of you may be interested in. I know that Sydney watched the webinar and this last weekend, and it did have some pretty good insights. It had Instagram best practices for state and local governments. So that was watched. DCF news release. Everyone did a great and getting some of that information out. We have some feedback on this from community members about concerns of who is distributing and what resources are available. For folks with questions on the program, they can reach out to DCF out there. And then also the hub site is something we've continued to work on and tried to hopefully improve, so it's a main source for all information that people want to go to. And there weren't any major updates to what we put out this last week, but I think it'll be critical as we talk about recovery and as we start to open businesses back up, and to make sure we're putting the resources out there as necessary.
And we'll probably look for a way to highlight food a little bit more. In case you don't know what DCF is, Department of Children and Families, and their office is on Euclid here. I don't even know if they're open right now, but that's what that stands for if you're not into the alphabet soup of different things.
McPherson Chamber continues to communicate with its members about needs to help promote ways that they're adapting special services, and they're offering a positive, uplifting way that they're giving back. Some of the new resources that they identified, and they've tried to get out to their members and to any businesses that are interested. SCED Disaster Relief Program, it's acronym SDRP, provides expedited loan financing for crucial working capital in amounts of up to $25,000 for COVID-19 disaster-related purposes to small businesses located within South Central Kansas Economic Development District, when McPherson County is a member of that SCED. So companies and businesses in McPherson are eligible to apply for that. Local business grants, McPherson Chamber is collaborating with MCCF, Main Street, United Way, and representatives from each of the communities in McPherson County. Grant application for local businesses with 15 or less employees should be available starting Monday, the 27th today. And grant applications will be reviewed by the committee as they come in. Grants of up to $1,000 each in McPherson are limited to the amount of available funding dollars that are out there. And those that wish to donate to this grant fund can go through the COVID-19 at McPherson County Community Foundation. So that's part of the efforts that McPherson County Community Foundation is working on. Restart Kansas Loans is a new program launched by Network Kansas is seeded utilizing 2020 entrepreneurship tax credits. Donors who receive a 75% state income tax credit for their donation. So if you're interested in donating, there's definitely that benefit that comes with it. 60% of the donations raised via tax credit in our county will be allocated to our county, where funding decisions will be made by the E-Community Committee. E-Community loans have been given through, that's a regular loan program that's offered through the chamber, I believe.
Yes.
And local businesses could be able to apply for up to $20,000 in loan funds. The Restart Kansas loan application will be provided once the local Restart Fund is established with the donations from the community. And then finally, CARES Act funding extensions, the PPP. There was a $320 billion extension of payroll protection program. Additional dollars for forgivable loans for small businesses as long as 75% of the proceeds are used for payroll are out there. I know that fund went through the first set of funds pretty quickly, so I would encourage anybody that's still interested in that and wants to continue to apply for that as quickly as they can. They do dedicate an amount of the new funds, the $60 billion, are earmarked for the PPP loans, and smaller banks, from smaller banks to reach more small and minority-owned businesses, particularly in underserved communities and rural areas. So hopefully, I think that probably applies to us. Contact your local lender if you're interested and apply today. Also, the EIDL received a $60 billion extension, and that's the economic injury and disaster loans. They include an additional $50 billion for low interest loans and $10 billion in grants through the U.S. Small Business Administration, also with inclusion for agricultural enterprises. Just as an FYI, as of the 19th of April, Kansas approved 116 small business EIDL loans for a total of $25,034,700, and also 5,219 EIDL advance for a total of $24,205,000. So there's a lot of money that's gone out in Kansas, and we appreciate the banks working with everybody to get some of those loans out, and we appreciate the state of Kansas working so hard to get those out.
Yeah, and I would say that if you filled out an application and then the money ran out, get with your banker right away. That application should be on file, and you need to have him pursue it immediately. It's expected that this money will be gone before the end of the week, so you need to act quickly if you want anything.
Nothing really new as far as current and planned action strategies and tactics. We continue to be on the same path that we were. We'll notice a little change, and we'd like to bring in Shaylee Shea and Julie McClure as part of the actual EOC Unified Command. So we're going to be talking about that a little bit on Tuesday, and hopefully bring them into the fold for that. And so, as far as supplies, we continue to be a struggle. I know we've really with the feds opening up some of the paths to get some of the equipment, we've done a little bit better than we have over the last several weeks at being able to gather some things. We did get gloves. We've gotten some hand sanitizer. We've been able to get some of the things we need. Some of the things are a little bit harder to get, the medical gowns and some of the things that are in short supply. We'll continue to work on. We're working with nursing homes. We've worked with, we received requests from nursing home, from physical therapy, and also from the YMCA this last week. And we're going to try, within our abilities to work with them on the stock that we have. And that'll be a significant discussion we'll have in this upcoming period, is how as we talk about businesses opening up, and how do we handle PPE needs for some of these businesses so they can get open and be providing services when PPE is such a major challenge right now. So we'll continue to work towards that. A lot of these just show different amounts of PPE used, so I won't kind of hit many of those items, but then I do want to get to the EOC objectives for this upcoming period. And a lot of the ones at the top haven't changed. If I go down to the last one before new items, I will say that that's an update. We did, as I mentioned last week, we're beginning conversations with relevant leaders in the state of Kansas and McPherson County on how non-essential businesses can begin to reopen, at least on a limited reopening basis, once the governor's stay-at-home order expires on May 4th. The governor has indicated there will be plans towards reopening that are being fine-tuned, and they'll involve decisions on a county-by-county basis. We are meeting. I know that the health department is going to have a meeting with the county partners on Tuesday of this week at 10 a.m. to talk about some guidance that she wants to give, and get some guidance from the communities as well about how we can make an effort to start reopening, and basically a little bit more of a plan when it comes to that. So we'll continue to talk with them. I think it's critical that we try to at least start opening up some of these businesses that have not had an opportunity to make any money for a number of weeks now, and we'll continue to work with them on that. Some of the new items for the upcoming operational period Yeah, I'm sorry, that's page 16.
Yeah.
So if you want to see that, you kind of, that line where it says new items for the upcoming operational
Okay.
period is where I'm at. We're going to communicate with McPherson County Health Department to give local input on reasonable reopening plan and effort to assist local businesses or critically need reopen, and just for the health and long-term viability of these businesses, getting that clear path forward so everybody knows exactly what they're allowed to do is going to be critical. We're going to work. The other thing we talked about, we want to work to coordinate a significant food bank drive to help keep the McPherson Food Bank sustainable as a resource as it starts to be utilized more and more. I will say that last week, though they were a little slow in getting it, last week was a big. They had a lot of people. There was fairly long lines. I talked to Joni that went down there, and there was, as of last Friday, there was a really, really long line. So it's starting to the point where I think some people have gotten, as some of these programs start to run out, that'll continue to be a bigger need. And so we're going to talk as the EOC group about how we can do an effort to help them out. Some of the food drives that we've had in the past are going to be a little bit more difficult to do. So we're trying to give them a little bit of a jump start so they can make sure that they stay on top of this. This is as funds start to run out, that's when the food bank's going to become more and more important. I don't want to take away from the fact that we've tried to do some foodless drive donations where we've got individuals to donate. We still want to encourage those, but we also want to talk about making something available to the everyday person that can help contribute as well. They can still contribute to the food bank through monetary means, so if they prefer to do that, we want to encourage that. But we're going to try to work on a food drive as well, where and we're talking about a food drive where we might actually have locations set up by the grocery store. So if you're in the grocery store, you'd have an opportunity to go out and buy your groceries and put some additional ones in there. We'll send out some information about what the biggest needs are, so hopefully people can do some focused buying if that's what they want to do. But we'll continue to work with them throughout this entire thing, and I think that's going to continue to be a bigger need.
And we'll use a city trolley, and we have a banner to go on the side of it, so easily recognizable if we're in the parking lots of Dillon's, Walmart, wherever, to help. So that's a good idea from Joni to try to do that and work with the other agencies.
Discuss and determine McPherson Community's role in obtaining PPE, which is personal protective equipment for safe reopening of currently closed McPherson County businesses. As we talk about reopening and having the supplies that they need to reopen, and disinfectant, masks, things of that nature, we're going to talk a little bit more about that in the EOC and what role we might play in doing that. We've continued to provide that role when supplies aren't available, but as we talk about reopening, having some of that stuff available is going to be critical. We'll continue to talk about that. Continuing to put out safety precautions for reopening strategies and support business reopening strategies that'll be adopted by the McPherson County Health Department. And some of these, we don't know what they're going to be yet, but we'll continue to work with them. But we want to do the best to help our businesses out here in the city as they reopen to make sure they're doing it safely so we don't have any setbacks. So I think if we give good guidance there and we continue to put that information out, it'll be critical. Begin discussing continuity plan for the city of McPherson operations as the virus concerns begin to diminish. We want to start having that discussion on the transition plan, as I mentioned earlier. And then we also want to begin talks on detailed options related to organizational expense reductions and within this organization as we continue to look at anticipated revenue losses that'll come from this epidemic. We're not immune like any other business. A lot of businesses that haven't opened, we expect drops to our sales tax, we expect drops to property tax, we expect drops to other fees, and so we want to bring, we've already kind of started to put some lists together, but we want to formalize some of that, and I'll be bringing that back to you gentlemen at some point. Some concepts and some ideas of what we do going forward, so we have enough funds to get us through the remainder of the year. Unfortunately, there's probably going to be some hard decisions that come with that, but we have an internal finance committee that's going to be meeting this week to bring you some ideas, so we'll continue to work with that. And so those are the ideas. That's what I have for the upcoming objective period. I don't necessarily know if I have any direct recommendations for this policy group to make at this point this week, but we're going to continue to meet on a weekly basis until we feel that we can extend it. The expectation, we'd go to 2 weeks at some point when we feel that time's necessary, and then we'll extend out those operational periods. So you may not get, going forward at some point, you may not get updates every week, but we'll continue to, as hopefully things get better, we'll be able to extend those out. So, any questions on anything in the briefing?
Any questions online? Okay, I'll declare that the study sessions are over